Good afternoon, everyone, and thank you for joining us for today's webinar, Social Security Disability Benefits Informed Decision Making. Today's webinar is sponsored by Acorda Therapeutics. I'm going to invite my colleague, Nakia Matthews, to just take a moment to give you a few housekeeping tips.
Good afternoon, everyone. Thank you, Elizabeth. The audio for today's webinar is being broadcast through your computer. Please make sure that your speakers are turned on or that your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel. And if you accidentally close this panel, you can reopen it by joining from the top menu, Communicate, and clicking Join Audio Broadcast. If you do not have sound capabilities on your computer, or if you prefer to listen by phone, you can dial the number you see here and enter the meeting code. Please note that you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of the webinar platform. If you would like to make the Media Viewer panel larger, you can do so by minimizing some of the other panels like chat or Q&A. We will have time for questions at the end of the webinar. Please use the chat box or the Q&A box to send any questions that you may have during the course of the webinar to me, Nakia Matthews, and we will direct those questions accordingly during the Q&A portion. If you are listening by phone and not logged into the web portion, you may also ask questions by emailing them to me directly at nmatthews@ndi-inc.org. Please note that this webinar is being recorded and that the materials will be placed on the NDI website at www.realeconomicimpact.org/financial wellness. If you experience any technical difficulties during the webinar, please use the chat box to send me a message, or you may also email me at nmatthews@ndi-inc.org. And with that, I'm going to turn it back over to Elizabeth.
Thank you so much, Nakia, and thank you to everyone on the line for joining us today. I will be your moderator today. My name is Elizabeth Jennings, and I'm the Deputy Director here at National Disability Institute. Today we're going to go over financial wellness, what it means, how you qualify for Social Security disability insurance, the impact of work on those benefits, where to turn for assistance. We're going to try to leave time for questions and answers, though we do have a lot to share with you, and we're going to give you some suggested next steps and wrap up. You have the chat box, as Nakia mentioned, so please send us your questions as you think of them, but save some for the end, and we can answer them then. And if you don't get a question answered today, please send us your email address in the chat box privately, and we'll be happy to respond to you. Or we'll give you our contact information at the very end. You're welcome to contact us at any point in time. I want to say thank you again to our sponsor, Acorda Therapeutics, who makes these financial wellness webinars possible. For those of you who are new to our webinars, National Disability Institute is a national research and development organization with the mission to promote income preservation and asset development for persons with disabilities and to build a better economic future for Americans with disabilities. Here's why. The national poverty estimates don't look so great for individuals with disabilities. For those 18 to 64, 12.5% of people without disabilities live below the poverty level. For individuals with disabilities, more than 2 times that number, 28.2% live below the poverty level. And when I updated these numbers for today's webinar, actually the poverty level had gotten worse for people with disabilities. We view the Americans with Disabilities Act as our mandate to support the economic self-sufficiency of individuals with disabilities. The Act says the nation's proper goals regarding individuals with disabilities are to assure equality of opportunity, full participation, independent living, and economic self-sufficiency. It's that piece of the Act that we focus on, as so many other disability organizations do an incredible job of focusing on the other pieces. So what is financial wellness? Well, we define it as the state of a person's finances with the intent of working towards financial behaviors that limit stress and the impact of stress on one's daily life. And anybody living with a disability knows that stress can just exacerbate medical conditions that are already challenging. So there's a lot of pieces to financial wellness. There's being financially literate, understanding your money and how to manage it, accessing affordable financial services. Are you with the right bank or credit union? Utilizing favorable tax provisions, which we're going to talk to you about on our next webinar in 2016. Budgeting, understanding public benefit rules, which we'll start to tackle today. Building and maintaining assets, accessing available healthcare subsidies, and understanding work and long-term disability options. While in the current webinar series, we're not able to tackle all of these issues, if you take the time to go to our archives, and Nakia, if you could put that in the chat box, please, you can find previous webinars on each of these areas. So why is it important? Well, it impacts our mental and physical health for everybody with or without a disability. It impacts our self-concept. It can actually change our status with other community stakeholders and give us a chance to have a voice in the community by having the funds to leave our home and participate in community activities and directly impact our quality of life. When you look at the financial wellness of people with disabilities and chronic health conditions, you find incredible setbacks. The most basic level of financial wellness is being banked or having access to affordable financial services. And we did a study last year that mined data from the from the FDIC that showed that individuals with disabilities are unbanked and underbanked at a rate much higher than those without disability. You can see that without a disability, it's the green area that are fully banked, and with a disability, it's the red and the yellow area that are unbanked and underbanked. That means that almost half, actually just over half, 51% of people with disability either are not using a bank or are using a bank but are still using other predatory services like payday loans and cash checking. We also, prior to launching this webinar several years ago, conducted a survey with our partners at MSAA. We learned that for individuals with MS, 51.1% of households earned less than $35,000 annually. When asked about the ability to pay all of their bills in a typical month, 32% had a very difficult time paying their bills, and almost half reported a somewhat difficult time. 43% of these respondents with MS reported that their financial status has affected their ability to access medical care at some point in time. Almost 72% reported that they do not have enough in savings to cover 3 months' expenses. 67.1% reported that their finances were worse since their MS diagnosis, and a large majority, 73.7%, reported they were not aware of or had not used financial stability programs that are available in their local area. And again, you can check out our Financial Wellness Webinar Series archives to learn more about these opportunities. The strategies exist. There are a lot of strategies to support financial wellness, and we're going to talk about some today, especially around Social Security disability insurance, but I wanted to give you this little view of how many there are. So again, in our archives, we address several of these, and if you see one on the screen or when you pull down the PowerPoint slides after today's presentation, please do reach out to us. We'd be happy to talk to you about any of these strategies and what services are available within your local area to help you. The challenge becomes that for millions of working-age adults with disabilities, a dependence on public benefits for income, health care, food, or housing becomes a trap that requires staying poor to stay eligible. But it really benefits you to have all of the rules. And so today we're going to tackle just one of those public benefits, Social Security disability insurance, and my colleague Kevin Nickerson, the co-director of the American Dream Employment Network here at National Disability Institute, is going to provide for you a clear understanding of how the SSDI rules work so that you can make your own informed choice about returning to work and have a better understanding of your ability to earn money and save money while holding on to critically needed health care or your SSDI benefit. So forgive me for going fast, but Kevin has so much great information to share with you that I want to just hand it off to him as quickly as possible. So thank you so much, Kevin, for joining us today.
Well, thank you for that introduction, Elizabeth, and thank you for joining us today, folks. Those were some difficult stats to see. I will say that this audience, which I assume is comprised mostly of folks that get some kind of a benefit, either disability or SSI, is my favorite audience to talk to, because I get to use two words that don't usually end up in the same sentence together, and that is Social Security disability benefits and exciting, because I hope what we will share today will be exciting to folks who are trying to look for a path back to financial security. There is a lot to cover, and we're going to try to dig right in now, and we'll see if we have some time for questions at the end. So Social Security administers many programs, but there are really two primary programs that we think of when we think of supporting people that have a disability that are unable to work, at least at substantial levels, and we'll talk about that as well. And that is Social Security Disability Insurance, SSDI, or Supplemental Security Income. You know, we know that many folks want to work, and they want to get to work and get to self-supporting levels again, but they're afraid and or have been misinformed in many ways by many folks, including sometimes information received from Social Security, which can be very confusing. So, you know, we understand a lot of people want to work, but it is a very confusing process. We're going to try to make some sense of this today the best we can. There are many work incentives, and that's the good news today. And despite all the kind of negative statistics we just saw, there is some good news. And these work incentives we're going to lay out today are often misunderstood. Often people don't understand them. We're going to try to make at least a few of these clear today so that you can make some real informed choices. Now, I did say that these are the main programs. Understand there are other programs we won't focus on as much today. One would be like, for example, children's disability benefits or disabled widow or widower's benefits. But again, today, I think given the complexity of all of these programs, we really have to just focus on one, so we decided to focus on SSDI benefits. So in terms of eligibility, well, Elizabeth highlighted that it's unfortunate, but often folks have to stay in poverty to stay eligible for the benefit. But there's other eligibility that are required, and specific to disability, here are some things that we wanted you to know. You have to prove that you have a documented medical disability that's lasted 12 months or is expected to last 12 months and or result in death. So it's a significant disability. Think of this as long-term disability versus short-term disability. This is not short-term disability like many states have and offer. This is long-term disability. It's a significant condition that gets people eligible for this. And so here's the other definition you have to meet that Social Security has put forward, and this is right in their manual. The inability to engage in substantial gainful activity, we're going to cover that, by reason of any documented medical impairment that will last 12 months or longer and or result in death. So it's not just that you have a condition, folks. It's that the condition prevents you from being gainfully employed, and we're going to go over those, what that gainful employment rule is all about in detail. So the difference here is that individuals who are blind don't have to prove they're unable to work. They only have to meet the level of blindness, and they do have to have insured status, which means that they paid enough into the system to be eligible, just like anybody would for disability. So we talked about this SGA. What is this all about? Well, it's a rule that comes into play for eligibility, but it's a rule that comes into play later, too, beyond eligibility. I'm going to show you both pieces. But in terms of eligibility, remember that slide previous just talked about that you're unable to perform gainful activity or gainful work. So what is that? Well, it's a fictitious number. It's a number that has been come up with that's based on percentage of poverty, honestly. And so if you look at the bottom here, it says 2015 SGA non-blind level. So for folks that apply that have a disability other than blindness, the SGA level would be $1,090 per month for this year. Now, I put next year's rates on here, too, because they were just published. So for next year, that non-blind level would be $1,130 per month. Now, if folks are blind, there's a different level. It's $18.20 per month this year, and that doesn't change for next year. So in terms of eligibility, going back to that, if you're working and you're earning over that at the time you apply, well, they're not even going to look at that application because even though you have a condition, a disability, it's not significant enough, apparently, to prevent you from being gainfully employed. So it's a combination of factors here. So this is what SGA employment is all about. And this is a test that's used during eligibility. Now, the other thing you should know is this is determined based on your gross earnings. So that's before taxes. There's some exceptions to that rule when it comes to self-employment, in which case they look at something they call NESE, or net earnings from self-employment. But generally speaking, when we talk about SGA, that's how it works. They're looking at gross wages. So that's SGA. Let's move forward here. So additional pieces on eligibility. I briefly mentioned that you have to have insured status. Well, what does that mean? Well, it means that you've worked enough and you have developed credits by paying FICA taxes. And I'm always curious if anybody knows what that is, because you're paying for it out of your paycheck. I always ask this when I do training. And believe it or not, after all these years, over 20 years of doing this training, no one has been able to tell me what that is. So if you want to type that into the chat, break that cycle for me, I would love that if you know what that's all about, because you're only going to have a few seconds here to do that, and I'm going to tell you what it is. There's some exceptions to that rule, though. When I talked about other kinds of disability benefits, I discussed Children's Disability Benefits, which is formerly known as DAC, or Social Security Disability for an Adult Child. That's an exception to that rule, and folks can actually be attached to this benefit based on a parent's work history, as long as the disability occurred prior to age 22. The person is not married to another beneficiary, a non-Title II beneficiary. And again, if they had insufficient FICA, again, this is one of the ways that they could still connect to this through a parent's actual work history, but there's a catch. The parent has to be either retired, disabled, or deceased for that to happen. So I didn't see any takers on FICA. Let me tell you what that's all about. FICA contributions, or what we call credits of coverage, again, are required for you to have that insured status to be eligible for this. Remember, this is an insurance program, Social Security Disability Insurance. And now the numbers will vary based on your age, but generally I just want you to know that someone would need to have about 20 quarters of coverage within the last 10 years prior to becoming disabled. What that means is Social Security is looking at your recent work. Now, you might wonder, what are these quarters of coverage? What are they all about? Well, you earn a quarter for this year when you earn $1,220 or more. Okay, so as soon as you earn that much, you've developed one of those credits of coverage. And of course, you can earn up to 4 a year. So that's how you earn this insured status, and it's through your payroll contributions. And someone asks, well, what is FICA? Well, that's a great question. That's the Federal Insurance Contributions Act. And that was established, I do believe, in 1935 as a tax provision of the Social Security Act. So that's what FICA is all about. You're paying for it when you work. At least it does something for you, though, folks. That's what I want you to understand, is when we pay these taxes, this helps to get us that insured status in the case, and we hope we don't need to, but if we ever needed to, it allows us to have access to disability benefits. Now, there's something else that comes with this benefit. That's medical insurance. And in this case, now remember, we're talking about disability. We're not talking about SSI today. We just don't have the time to cover both. But when we talk about disability and medical insurance, we're talking about Medicare. That's what people are eligible for, but they have to wait. There's a 24-month waiting period once you're eligible for cash benefits. There's different parts to this. Medicare, and folks that are on the line that get this benefit certainly know what I'm talking about. There's Part A, that's hospital insurance. There's Part B, that's like your routine care, and Part D, which is now available, which covers prescription drugs. Now, there's another piece of the puzzle here I want you to understand in terms of eligibility, is there's a 5-month waiting period. So even after Social Security goes through the process of looking at your claim, and let's say they approve it, and they figure out your date of onset, that's an important date that they sort out. When did this start? then there's a 5-month waiting period for you to receive benefits, cash benefits. And it's after you receive that first cash benefit that the 24-month waiting period begins for Medicare. So, you know, this is looked at more like an insurance program. That's why these things are designed this way. We talked about SGA and how it impacts eligibility, meaning you have to be below that amount when you're applying for benefits. But I'm assuming a lot of the folks that are on the line today already have this benefit, and I'm going to play out more in subsequent slides. Well, what does this SGA rule do after eligibility? And that's really going to become important in today's conversation. This last point is really interesting and important. We talk about, you know, asset limitations for many programs, but again, because this is an insurance program, there's no asset limit for disability. So it doesn't matter how much you have in the bank and so forth, you know, things you own. Your entitlement is based on that insured status and, of course, meeting the disability definition. But assets are not a problem, folks. So if you have disability and you thought that that was a problem, it's not. Now, it might be for other programs that you're on, but not for disability. So let's talk about this process Social Security uses to continue to look at whether you meet the criteria. This is called a continuing disability review. So by law, Social Security has to periodically look at everybody's claim that gets benefits to decide if they're still disabled under the rules set forth under the Social Security Act. These are called medical CDRs, by the way, folks. So under this standard, once individuals are receiving benefits, these subsequent reviews have to have, you know, evidence in play that shows that medical improvement has occurred, okay? And that the ability to work and perform SGA level employment has occurred. If that's not the case, you continue to get benefits. So Social Security has to develop this, by the way, before they would decide to ever stop benefits. And it involves a few steps, as you can imagine. One is an interview at the local office, and there's some forms, of course, that will be filled out, and then Social Security sends that information on to the Disability Determination Service that they often contract with in a state, could be a variety of agencies, for them to review and decide if you are medically disabled still. The last thing I want you to know about CDRs is you might wonder, well, how often do they happen? And that would be a good question, because it depends, like many things in this world of Social Security. It depends on the severity of your disability, but generally I can tell you, folks, that they will occur every 1, 3, 5, or 7-year increments. And again, that'll be based on the severity of your disability. Now, some interesting news you might not have heard before is that CDRs can be suspended when someone is using their ticket in the Ticket to Work program. If you don't know what that is, well, hold on, because we're going to cover that today too. Some more important points that I thought you should know about disability. After eligibility, Social Security continues to monitor your earnings to determine if you are performing SGA-level work activity. I guess you could say this is something that's very much on the forefront of what Social Security does. They're always looking at this. They're always wanting to know, if people have returned to work, of course, and how much you're earning. This can impact your ongoing cash benefits and eventually ongoing eligibility. But there are a number of work incentives that protect beneficiaries like yourself that do attempt returning to work for quite a period of time, and we're going to discuss those. And that's what gets a little more exciting about the rules that are in play here. Remember that SSDI is an entitlement benefit, and it's based, again, on your earnings and the FICA contributions that you made. And I'm just reminding you, again, there's no asset limit for this benefit. Now, this chart here that I put up certainly looks confusing, and I don't intend to go through all of it, but here's what I want you to know. This ruling does highlight a Supreme Court decision that can impact when work incentives become available to newly eligible SSDI beneficiaries. Again, it's not my intention to review this whole decision closely with you today, but I want you to understand this simple piece, that if you return to gainful employment within the first 12 months of an initial favorable decision, or before a final favorable decision on your case has been made, this can create some issues with both eligibility and availability of certain work incentives. What I really wanted you to see from this today is this, and I'm going to continue to encourage this throughout today's training. Whenever possible, I highly encourage everybody on the line to get connected with a certified work incentive counselor. I'm going to provide you information about how to connect with somebody who can support you in that way. And this is just one example of something they would look at, especially if, you know, and I didn't really give you my background, but I've been a work incentive advisor for over 20 years, been involved before there was any formal certification process, and then later when there was, I was involved in both the BPAO project, which is the predecessor to WIPA, which is Work Incentive Planning Assistance Project, which I also worked under for a number of years. And whenever somebody would come in and talk to me about the fact that they just started getting benefits, this always came to my mind. Okay, well, let's really look at this closely because we want to make sure we do the right things, especially after initial eligibility. So why did I put this up here? Not to scare you, but for folks out there that might be new to benefits, I want you to understand, I really want you in front of somebody that can give you good counsel about the return to work. Now, if benefits aren't new to you and you know, you've been on benefits and you're beyond that period where we have to be concerned, you have a number of work incentives available to you. Here's a comparison chart. Here's the one opportunity I'm going to give you to look at both disability incentives and just at a glance, SSI incentives. Because if there are folks on the line today that get SSI, I don't want you to feel left out. I apologize, we can only cover one, but one benefit is enough in terms of complexity at a time. You can see there's a lot of work incentives for both. But we're going to focus on the left here on the Social Security disability side of the fence, and we're going to walk you through a number of these incentives that we think are important for you to understand. Again, you know, if you know, when we're done today, you know, my intention is not that you'll be experts on this, but that you'll be informed about some options that you have, and from there, that you'll take that forward and get connected with somebody that can give you this guidance. So here's the specific incentives I want to hone in on today. The trial work amount, okay, and what is a trial work period? We're going to talk about that. The extended period of eligibility, impairment related work expenses, something called special conditions or subsidies. We'll talk about extended Medicare coverage because I can tell you there's not one person I've talked to over the years that isn't concerned about what's going to happen to health care if they return to work. So we're going to cover that today too. And then another little gem that most people don't know about called expedited reinstatement of benefits. That's fairly new, and just to preface what I mean when I say fairly new in the world of Social Security, I think that's anything that's less than 10 years old. Let's talk about trial work. Here's some good news for you. So folks that get disability benefits are entitled to this trial work period. There are 9 trial work period months available for you to test your work skills while continuing to receive your cash benefits. During this trial work period, you will continue to get your full benefit check regardless of the amount of money that you earn. Now that's hopefully good news to folks. Here's something else you need to understand. These trial work period months don't need to be earned in a row. They don't have to be consecutive. Well, when do they count these months? Well, when 2 things happen. 1, you go to work, and 2, you earn more than the trial work level, which we've put in this next bullet here. So they're counted when you earn a specific amount of money in a month. Each year this changes. I gave you the number for last year. I'll remind you again that next year that trial work level has been posted as $810 per month. This year it's $780. So you have these 9 trial work period months. If and when you use all 9 of these trial work period months within a 60-month rolling window of time, so within a 5-year period, it's going to start the next part of this incentive package for you that Social Security calls your extended period of eligibility. But before I go there and talk about that, how do you figure out how many trial work period months you've used? Now, if you've been a good record keeper, you've kept track of your earnings since you started getting benefits. You've probably been reporting them, I hope. I'm going to strongly encourage you to do that today, right along the path here of our discussion, because it's good for you if you report. It's better for you than it is for them, for Social Security. So you probably kept track, and you could just look at months you've earned over the 780. That's one way to do it, but you might say, well, I don't remember. How can I find out how many of these I've used? Well, let's just pause before I move into the next incentive and talk about how you can get a report that will help you understand how many of these trial work period months you might have used already. You have access to a report called a Benefits Planning Query. They call it a BPQY. In this report, in this BPQY, there is information about your benefits, such as the type of disability benefits you receive and the cash amount that you receive, your health insurance, your scheduled cycle for your next CDR, that medical CDR we talked about. If there's a rep payee associated with you, that'll be listed. It'll also show you some, a little bit of your work history, including the use of any trial work period months. Now, Social Security will provide these reports to beneficiaries. They will provide it to their representative payees and authorized representatives upon request, and I'm going to show you how you make that request. I want you to know something else, though, that while this BPQY is definitely a critical tool in assisting you in understanding your benefits, they may not always be up to date. Again, I'm going to come back to this recommendation. It's advisable to have someone who's certified in understanding benefits and work incentives to work with you and examine this report with you. For my many years of service, I would always critically examine this BPQI to see if the information really reflects what the customer told me about their work history. And of course, I was reviewing this with the customer. Sometimes it was necessary for us to contact the Social Security office and maybe update them on some recent work that was not included. And if that happens, it certainly could change the information reflected in the BPQI, after which you could request an updated BPQI. So I'm telling you two things here. It's good to get this and request this. As a beneficiary, you can request this directly. As an authorized representative, I'm going to show you on the next slide how you get these. Number two, I'm telling you to look at them critically. Make sure everything in it looks accurate. And you'll probably be better off reviewing this with somebody that has an understanding of these reports. So here's how you get one. I've given you a bunch of information here, and you'll be able to access this PowerPoint, but it gives you the number and times that you can call. That's one way to do it. But if there's someone other than yourself, the beneficiary, that wants to request this, for example, a rep payee or an appointed representative, they need to submit two forms to make that happen, and they're called SSA 3288 Consent for Release of Information forms. And so, for example, if I was asking for one of these, and this is, I've done this plenty over the years, I would have to complete the 3288, which includes information about me if I'm making that request, and my association with you, let's say my customer, and you would have to sign off on that, and it includes information about you, your name, your Social Security number, a couple other items, and then you need to be signed off on. There's actually two of these that need to be submitted. They look the same, but one is to release the actual Social Security records, so information about the use of your trial work period and insurance you receive and so forth. But the other is to release information that Social Security gets from IRS, and that would be your earnings information. So both of those need to be completed. Now you might say, well, that's great. Where do I get these things? And there's a link here we provided you in this slide so that you can access these forms if you are working with somebody and they want to give you permission to help them get that report. Again, I'm going to go back to, I really recommend that you work with, say, somebody through the WIPA project. I'm going to show you how to access people, the Work Incentive Planning Assistance project, that is. In subsequent slides, we'll show you how to get to those folks. But make sure you're working with somebody that understands this process. So if you are working with somebody that understands these reports, and certainly somebody through a WIPA project, for example, what they will do with this report is incorporate this into a really thorough report for you, often called a benefits summary analysis. Very useful information, very specific to you, their customer. I mean, they don't all look like this, folks, but I just gave you an example of what one might look like, and this is one of about 8 pages in this report that you get. Some people don't like the whole, might not gravitate to understanding that kind of a long report in a written format, but a lot of people really appreciate things in written format. And I'd say, you know, it's a critical piece, starting point when I would work with folks, is to develop this kind of a report with them so we had a baseline, you know, because they may come in and say, I'm not working now. What's going to happen if I do this? Here's my goal. This is what I want to do. What's that going to look like? And if they do that, you know, if I have that to work with, you know, the goal, which of course is what we're trying to get to when we write these, then we can kind of play out, well, this is what it would look like, okay? And if you stay connected to somebody that can give you this kind of advisement, when you actually get the job, then of course this report needs to be updated because things changed, right? Because now you have a job, and we're not projecting numbers. We know what the numbers are. I've been offered this job at this many hours at this wage, and that report would be updated. So another advantage to working with somebody that can give you this kind of guidance. So back to work incentives. We talked about trial work. Okay, let's say you use those 9 trial work period months. Within that 60-month rolling window of time we discussed, what happens next is you get another 3-year period that Social Security provides called an extended period of eligibility. Now, a couple things, there's a number of things you need to understand about this. Unlike the trial work period, okay, those only get used when you're working over that certain amount we talked about, $780 this year, $810 next year. Once the extended period of eligibility begins, whether you're working or not, it's done in 36 months. Now, I'm telling you this because I'd like to see people use this incentive package wisely and to really plan the use of these incentives, okay, based on your work goals. So what does this EPE do for you, though? Well, it's another protective period. It's to help you in the transition to work. It protects your eligibility status, as it indicates, extended period of eligibility, not necessarily your monthly cash benefits. So here's what Social Security does. During this EPE, Social Security evaluates your gross wages each month, okay? During that EPE, they will also take into account additional work incentives that may be in play here, and I'm going to play out a little bit of what that means too. And if your earnings are more than the SGA amount, you may not receive your cash benefits that month, okay? But you haven't lost your connection to the program. You're still an SSDI beneficiary. You're still getting your health insurance during this extended period of eligibility. The only question is, if you're over that amount, Social Security is asking themselves, based on the evidence in play, do we pay you that month or not? That's the question. Here's some more things you need to know about the EPE. So when countable, you know, I put a term here called countable wages. That's an important thing to understand, and I probably should have spelled this out a little better in the slide, but countable wages are what's left after they look at gross wages minus any work incentives. And at the end of the day, that's what they are really looking at to make any SGA determinations. So after the trial work period, the thing that can happen and will happen if you're working at significant levels is eventually benefits will cease. I didn't say termination, I said cessation. There's a difference. When your wages exceed the SGA level for a period of time, usually it's a 3 to 6 month period that Social Security monitors and sees a pattern of earnings that's more than SGA. The first month of that pattern will be your cessation month. The next 2 months are part of a package they call your grace period. And for that 3-month period, even though they've established, hey, we should have stopped paying you on this month because of your earnings, that month and the next 2 months, they're going to continue to pay you, even though you're over the SGA limit. More good news. So now we have 9 months, and we've got 3 months, so we've got a year where we know that you can continue to receive benefits, even if your earnings are way over the SGA limit. Well, let's talk about termination. And I don't want that to be an ugly word to people, because I got to tell you one thing in my experience of helping people return to work that I've come to understand is this. Termination of benefits should never be a surprise. It should be a planned event. If you're working with an advisor, it will be a planned event. It will not surprise you. So let's get that out of the way. I don't want you to think that this would come out of the blue because you're being advised properly. You would understand when this is going to happen. But when the extended period of eligibility is over, that 3-year period, if your earnings continue to be over the SGA limit, and there are incentives, okay, that can reduce that amount they look at, what we call that countable wage, that's when they can terminate benefits, okay, but not until that time. Now, for self-employment, the SGA determination is very much similar, but it is a little different in that they can also look at the number of hours somebody's working to make an SGA determination, not just the amount of net earnings produced from that self-employment. That gets a little more complicated. Definitely don't want to get too much in the weeds with that today, but I wanted to always point out self-employment is a little different, so you better make sure you understand those rules by connecting with somebody. Here's your reminder. That 36-month extended period of eligibility begins the month following the 9th trial work period month that you've used, okay? So if you happen to work that 9th trial work period month and you just stop working for whatever reason, it doesn't stop that extended period of eligibility from beginning and ending 3 years later. Now you may, in a lot of cases, it is the case where somebody works through their trial work period and right into the extended period of eligibility, but I just want to be real clear on that because that can kind of disappear and be gone out of your view in terms of being able to use that effectively if you're not careful with it. This slide kind of captures all these pieces we talked about, and frankly, I like this. This is, you know, more visual, and I think a lot of people are. This makes more sense to me. So let's look at this. This is sort of the SSDI timeline, I like to call it. And where you are in this really depends. When we meet with folks, they could be at any place in this timeline, from the beginning all the way to the left there, just before the trial work period. In other words, you haven't used any of these incentives, to somebody who's way beyond the extended period of eligibility. So that's the need for that report I talked about. That's why we get that benefits planning query, because I don't want to guess these things. I want to verify them. Okay, that's what we do. We verify information. But again, here we've got this visual look at this whole process. We've got the trial work period, 9 months available, remember. Only count if your earnings are over 780. If you're not over 780, you're not even showing up on the radar yet, okay, folks? But if you're over the 780, and if I don't care if it's 1780, I don't care if it's 7,000 in a month, you're keeping your benefit, and they're counting one of those months, okay? So let's say January of this year, you had all this incentive package available in January, and you start going to work, and you're making $2,500 a month. Well, that first month, January, is $2,500 more than 780? It sure is. So that January would count as your first trial work period month. Let's say you carried on and you worked right through for 9 months. That would be over, trial work period. And let's see, that would be, I think, around September. Is that right? October, I guess, would be the beginning of your EPE in that example. Now, from there, we can then project, well, when is the EPE over? Well, if I know when it starts, I can certainly tell you when it's over, because it's over in 36 months. The good news, though, about this EPE, again, is that it provides you protections from losing your eligibility to the system, to the program. It doesn't necessarily protect your monthly cash benefit. It really depends on your earnings. So if you're over SGA, you might not get your benefit. If you're below SGA, you're going to get your benefit. Now, when I said if you're over SGA, I said you might lose your benefit, didn't I? I'm always careful about how I say things when it comes to Social Security. You might, because you might not as well, even though you're over SGA, because we may be able to use additional work incentives to reduce your gross wages, and I'm going to show you how that works, to a level that they would only count certain wages that are below SGA. That's where we get countable wages. We'll talk about that more. Now, I showed the grace period sort of shown up right after the trial work period. It doesn't have to. That grace period could happen any time after the trial work period, not necessarily right after the trial work period. It occurs when they start to see that pattern of earnings, remember, that's over SGA. That's how they develop your cessation month. When should we stop benefits? Because the person has a pattern of earnings over SGA. Okay? So this is just, in a nutshell, a view of what's available to you. And I hope this is, well, I don't necessarily hope this is new to some folks, but I hope if it is new, that this is exciting and that you see that there's opportunity for you to go back to work and try things without immediately having the rug pulled out from under you in terms of your benefits and health insurance and so forth. So really, again, let's come back to that note at the bottom. 12 months. You can earn as much as you want if you have that trial work period and extended, grace period still available. And why do they offer this? Because they want you to try to go back to work. They want to see how you're going to do without pulling that rug out from under you, because it doesn't benefit anybody to stop benefits immediately if you try something and it doesn't work. That's what this whole incentive package is used to evaluate. Let's talk about some additional work incentives. So that's kind of the nickel tour of the basic incentives available for disability that I think everybody should know, but there are many more work incentives that can help you in this process of returning to work, one of which is called an Impairment Related Work Expense. Now, this can apply to folks that receive SSI, but the way it impacts people that receive SSI is very different. So I'm just going to focus on how IRWE impacts people who get disability today. So what is it? Well, it's a way to account for additional expenses you might have as somebody who's working and who experiences a disability. So it's really a way of evening the playing field, if you will. You know, if you've got an expense related to your condition that somebody doesn't have because they don't have that the same condition you do, and that you need that item to keep working, you may have an impairment-related work expense we might use. So here's when it exists. This first section here talks about when does an IRWE exist. Well, when you pay for something out of your own pocket, when the item is related to your condition, and last but not least, that you wouldn't be able to work if you didn't purchase this item or service, okay? So 3 key ingredients. It's got to be paid for out of your own pocket, it's got to be related to your condition, and it has to be necessary for you to continue to be employed. Well, let's think of an example. And I do have some examples on the next slide, actually, so I'll hold off on that, but there's many examples. But let's talk about instead, what does it do for you? Well, remember we talked about during the extended period of eligibility, if you're over SGA, they may not pay you that month. I left some wiggle room there because if you're over SGA, but you have an impairment-related work expense that we can use to reduce some of those gross wages that might leave you below SGA, well then, even though you're earning more with this work incentive in play, you may still be able to receive your benefit that month. So let's look at this bullet that I put together and constructed for you to understand this. So the amount of your approved IRWE is going to be deducted from gross wages. That leaves what Social Security considers countable wages. That is then used to determine your continued eligibility for either just eligibility outright or eligibility for cash benefits if you're in that extended period of eligibility. So in short, an IRWE is used specifically for people that receive disability to allow a certain amount of wages to be excluded when Social Security is making these evaluations on your claim. So it's very important that you understand this. Here's some examples. And there are others, but you know, we'd have to spend a little time, you know, and of course you'd need to spend some time with somebody that really understands these incentives, and these are things that you would kind of sort out with that person. But certain transportation costs, okay, and I think I'm going to speak on that one item just to show you that while there's some things on the list, there's always these caveats that we have to be considering, okay? For example, in the case of transportation, if there's a cost of modifications to your vehicle that you need to travel to work, even if you use that vehicle, by the way, for non-work purposes, that can be a write-off, okay? That can be an IRWE. Other things, let's think. The cost of maybe a driver to get you to work because of your disability, because maybe you can't drive, okay? So maybe you're even paying for a taxi ride. Maybe you're paying a friend to take you to work because you can't access public transportation, or there's a lack of it, and or you can't, you know, you're not able to get a driver's license, for example. There are even cases where, for transportation, you can even write off mileage in some cases, okay? So I don't want to put blanket statements out, but these are all possibilities. You can see this list here. I don't need to go through them each, but for each there are criteria that we'd have to look at with you individually. But there are a number of things that can be used. But rather than be focused on exactly what those things are that could count today, let's look at what does it do for you, okay? What can this do for you? I think that at the high level, the first thing we have to understand in this slide is this. We don't need to use an IRWE for somebody who receives disability unless they're earning over SGA, okay? And the amount over SGA isn't so far beyond what's possible to write off that it wouldn't be, feasible to use an IRWE, for example. So I gave you this example, which often is the case. Somebody wants to work, and I bet you've heard this before. If you're a service provider out there, I bet you've heard this. Or if you're a beneficiary, you might have been forced into this. And I think there's another way to look at this. And here's the example. You're working, you're earning, you have the opportunity, let's say, in this case, John we're talking about, to earn $1,200 a month. Now, we know that the SGA level for this year is 1090, okay? So let's just put this in perspective. John has an opportunity to make $1,200 a month in gross wages. Maybe he's getting $1,000 a month in his disability check. Does it make sense to earn $110 more than SGA and lose $1,000 a month? I don't think so, and nor do any of you out there today. So instead, what can we do, or what do people do? Here's what often people do, which is disappointing to me and discouraging. They'll just say, well, I'm not going to take those extra hours, or no, I'm just going to stay at this level of earnings because I know this is safe. And I don't blame people for doing that. I really don't, especially if you didn't understand these incentives. But now that you're getting a taste of this today, I hope that you'll look at things a little differently. Here's a great example where John is working. He has an opportunity. This is somebody that I actually thought of that I've worked with over the years. He has this opportunity to make a little more than SGA, all right? And he's going to take it because we talked about this, and we knew there was some things going on. In his case, John had some out-of-pocket expenses that were related to his disability and, of course, his ability to continue working. Here's what it is. He pays $150 a month for paratransit services, transportation services, which is just an alternate mode of public transportation services that requires eligibility, right? It runs in parallel. That's why they call it paratransit. It runs in parallel with your public transportation. There is a requirement, though, for you to be eligible based on disability. So we know it's related to his disability, his condition, okay? And he's using this to go to work. And he's paying $150 a month for this out-of-pocket. There's the ingredients, right? He's paying for it out-of-pocket. It's related to employment. It's related to his condition. So what do? John took that job because we knew these expenses existed. And already did some math before he even moved forward. And instead what we looked at the $1,200 in gross wages. We're able to subtract that IRWE, which was submitted to the local Social Security office. The remaining amount, or what's left, right, gross wages minus work incentives equals countable wages. That last line there, countable wages of $1,050, is now what Social Security is going to look at for that month, which is now less than SGA. So he got to work and earn a little bit more than SGA, which was really what he was capable of doing and wanted to do, but was afraid to if we didn't have this in play. We submitted this IRWE. They wrote off the $150. They looked at the amount that was left, which was less than SGA. John continued to get his $1,000 in this example that I didn't put on the slide, but in this example I said $1,000. He gets to keep receiving that because he has an impairment-related work expense that we were able to write off. So I hope that makes sense. That's how it's used. It's used in situations where somebody has out-of-pocket expenses related to their condition, related to employment, that is able to be written off their gross wages, which leaves an amount less than the SGA amount, allowing John, even though he's working over SGA, to continue to receive his benefit that month. Now, he could continue to use that every month if that was his expense every month. It would just need to be submitted, okay? We'll talk a little bit about reporting, too. But I have another incentive to talk about, often misunderstood, one that I've used a fair bit over my years, called a subsidy. It's the same idea. Now, this, by the way, is only going to apply to people who receive SSDI benefits. So this is an incentive only for folks that receive disability insurance benefits, okay? So what is it? Well, it's always hard to describe subsidy, but a subsidy exists when an employer provides accommodations. I think that's the easiest way to look at it. Support, maybe extra supervision, maybe they customize the job to meet the needs of the person working there a little bit. Maybe the employer allows for a lower productivity standard for that person at the same wage. You know, some of these things sound real negative, but the bottom line, folks, I want you to understand about subsidy is this. This happens all the time. I like to couch this under the term job accommodation. This is really what it is. It's a way of honoring an employer who's offering a job accommodation to somebody and putting a value on it, because if that didn't exist, maybe that person wouldn't be able to work. So that's the theory behind subsidy. That's why Social Security will honor this. Now, there's another piece under the umbrella of subsidy called special conditions. This is when an agency, an outside agency, maybe assists somebody in securing employment, job developer. Maybe that they provide you with accommodations you need on the job. Maybe they provide some equipment. Maybe they support you to get to work, providing a ride for you. Or on-the-job supports, maybe job coaching, for example, okay? So that's when an agency is involved, and it falls under the umbrella of subsidy, but it has a specific category called special conditions. Let me give you an example, because it's one thing to talk about it. It's another thing to look at this in real life. So here's our example. Jake's working for a restaurant, another real example, by the way, somebody that was helped in this way. Jake works for a restaurant. He's making $1,260 a month in gross wages. He's very well liked by his employer. He does have some physical limitations that prevent him from lifting grills that are cleaned daily. And so one of his coworkers will handle this task. So while that's normally expected of folks in his position, the employer is making an accommodation. They like Jake. Jake does a good job. He just can't lift that heavy grill, okay? So again, I put here, while it's a normal part of Jake's job requirement, the employer has accommodated Jake by having another employee take on the task. Jake is allowed to arrive later than normal as well because a family member drives him to work since he can't drive, and public transportation is not available. In this example, Jake has used his trial work period up. That means we know he's beyond that. The grace period has been established in his case, and he's midway through his extended period of eligibility. So let's break this down. If he's in his EPE, now Social Security is again really interested in looking at that SGA rule, right? Which on the surface, if we just looked at this and Jake took this job, and let's say again for simplicity's sake, Jake has that, let's say Jake has $1,000 in disability. He's over SGA. He's making $1,260. We know that the number for this year is $1,090. So what is that, $170 over the limit? Not enough to lose $1,000, is it? Right? Again, not a good move. But with the use of this incentive, we're able to be a little more flexible. We're going to show you how. So it's more than the SGA limit based on those gross wages. And based on gross wages alone, well, technically he wouldn't be eligible for cash benefits that month, right? Let's look at how subsidy can help Jake out. And I do see some comments. I know this is a lot of information. I apologize, folks. It's a lot to digest. Again, I don't want folks to feel like they're going to go away with my intention of you being the expert today. That's not the point. I just want you to be more aware of options that are available to you. So I saw a little comment. I'm not going to say from who, but this is information overload. And I agree. It's like being fed with a fire hose, isn't it? And I apologize for that. But there's so much I want you to understand today. So let's carry through this employer subsidy example. We know Jake is working. He's a little over SGA. And on the surface, that's kind of a bad move. And in the real world out there where people don't know how all these things operate, what would happen? Well, they'd probably say, hey, Jake, work less than SGA. Hey, work fewer hours, right? And that happens all the time. And I understand why people would take that stance if they didn't understand how to use and take advantage of some of these work incentives. But when you do understand it, here's what we look at. In the case of subsidy, there is a certain form that Social Security will send to an employer. It's called the Work Activity Questionnaire. And it helps Social Security to determine if there is a subsidy in play. I've given you some categories right here in the middle of this form. There's about 10 categories here, right? Well, there's actually 10 categories exactly. In this case, based on what I explained to you about Jake, we were able to check off a couple items. One was fewer or easier duties, right? Because somebody else is taking care of that grill for him. And special transportation, right? He's got somebody bring him to work. The employer's allowing him to come in a little late. They're allowing it because they like him. They're making an accommodation because they want to keep him around, and they're allowing for this situation. So if we use these categories now, we can then evaluate an amount that this is worth. Now, really it's up to the employer to determine that. In subsequent part of this form, the employer is actually asked to evaluate the value of Jake's wages compared to others. It's very difficult for employers to do. This is the one time when I would often be involved with an employer, in cases even where folks had not disclosed, in fact, that they even worked with us. We might have been behind the scenes for years, but this is an example where it's important, I think, to get somebody involved that understands this process. Otherwise, employers will sometimes complete this incorrectly, but somebody who's trained in understanding these incentives will walk that employer through what this really does for Jake in this example. So let's follow this through a little more and look at, now that we've checked a couple categories, let's just say that there was the employer determined it was a 20% subsidy, okay? And honestly, you know, when you look at that form with the 10 categories, if you were to look at the 2 checked off, often employers will say, well, why don't I just add, you know, account 10% for each one of these? And that's how often this is arrived at. So if there's a 20% subsidy, which we figured out in Jake's case because of a couple of categories that he's being accommodated, this is what Social Security would do. Again, they'd take the gross wages, they would subtract the value of the subsidy. Now, how does that work? Well, 20% of $1,260, that's his gross wage, is $252, so we get to subtract that. That turns out to be $1,008 that's left in countable wages. Remember, gross wages minus work incentives equals countable wages. And countable wages is what Social Security makes decisions based on when it comes to SGA determinations. So in this example, since Jake's countable wages are again less than SGA, that means Jake's going to continue to be eligible for his cash benefits, okay? So that's pretty exciting. So here's an example of, in the real world, where unfortunately these incentives are not known of widely, often someone like Jake would work and earn less than SGA. But it, you know, his spirit is telling him, I want to do more, and I can do more. And that was exactly the story. And so we were able to use this incentive to help him actually achieve what he was capable of, not, you know, letting the fear of the SGA rule dictate the steps that Jake took in his career path. Of course, he had good advisement, and I may be a little biased, but that was me in this case. I was helping him through this process. And he, you know, he continues to work at that same place to this day, and that was well over 10 years ago. So that's subsidy, okay? Now, what about reporting? Well, remember that both of these incentives, both IRWE and subsidy, are used to reduce the amount of gross wages that leaves countable wages that Social Security looks at. And I can't stress again enough that I think it's really important that you have somebody who's certified in Benefits and Work Incentive Counsel to assist you with this, okay? I really would hate to see you take this on yourself. Both of these incentives in both of these cases would need to be reported to the local field office, and evidence has to be submitted along with them, including your pay stubs. But I'm going to talk a little more about wage reporting separately. But so with IRWE, you'd have to have receipts, for example. So if you're stating you have a cost remember the example we used to paratransit? No problem, just keep the receipt, and you're going to submit that to the Social Security office, or somebody will do that along with you to help you. When it's subsidy, well, the documentation needed was that form I showed you. Now, there's additional evidence that could be submitted from an agency. Let's say that there was a job coach involved, right? We talked about that as a possibility of special conditions. It works the same way. There's a way to put a value on it. I'm not here to point out exactly how you do that today. I want you to know that this exists. And if you're somebody that's receiving that kind of support, that I want you to talk to who you're working with and say, hey, is this an incentive that would work for me? Okay, so for subsidy, it's that work activity questionnaire I showed you earlier. So what do they do with this? The claims rep reviews this information, and then they adjust your wages accordingly before they make an SGA determination. If it's in the case of IRWE, you know, if you really should talk to your claims rep about that. If it's an ongoing expense, there's other ways to deal with that. For example, they might say, you know, send it in quarterly, but work that out locally with your local claims rep. One interesting thing I didn't tell you about subsidy And one of the things I love about subsidy in terms of its use in a practical sense is that once that's established in play, as long as that person works at that site for that employer, that remains in play. I don't have to turn in any more paperwork to keep that in position for that person. So in that case of Jake, once that was submitted, like I said, he's still working there to this day. They still take into account that subsidy that was put in play many years ago. All right, so you only have to submit that once. That's one advantage of subsidy, just from a paperwork standpoint. And last but not least, the individual has to continue. You have to continue to report wages monthly. And in the case of IRWE, again, make sure you're documenting all those expenses. Okay, so that's a kind of a snapshot of work incentives. I don't think we can leave you today without talking a little bit about your health care, though. Medicare continues, okay? I want you to understand that you have an option for extended Medicare. You're entitled to your continued Medicare coverage, of course, during the trial work period and all the way through the EPE, but here's what I want you to know. You're going to get Medicare for at least 93 months following the 9th trial work period month, okay? And during that entire period, your hospital coverage, that's Part A, right, is automatic and cost-free. Now, Part B continues to be optional and would be subject to a premium payment. This year, it's $104.90, and so you'd be responsible for paying that. And let's say you're in a situation where you're in cessation, you're not receiving benefits payments anymore, you'd still have to pay the premium, and they would bill you quarterly. But the good news is you're still eligible to remain connected to Medicare for at least 102 months when we add in that trial work period. So that's good news, and you do not have to worry right away at all about that when you return to work. Of course, that gives you plenty of time to evaluate if your employer has a good plan and so forth that you could get involved with. Now, I told you about another little hidden tidbit that I was excited to talk about with you today called the expedited reinstatement benefits, expedited reinstatement of benefits, or EXR period they call it. But basically what this is for is, let's say, and I bet there's folks out there wondering, you know, well, this all sounds great, Kevin, but what happens if I try returning to work and my benefits are eventually terminated, which I hope is a planned event we talked about, and then my disability again keeps me from working gainfully? What do I do then? I've used this whole incentive package. I've gotten to the point where they terminated, and I'll call it a successful termination because you planned that with somebody, and then you have to stop working again because of your disability. Well, prior to EXR, there was not a great solution. It would be apply again. And that scares people, and I wouldn't blame anybody if it did. But this EXR provides you a significant level of protection if you go back to work and that situation happens to you. So here's the eligibility for this. So let's say you're that person that went to work, you got terminated, and then you had to stop working again. You can be reinstated without a new application, okay? This is sort of a backdoor to Social Security is the way I look at it. If you were eligible for disability, which of course you would have been, if you lost your disability due to the performance of SGA, which is in the example I gave why they probably terminated, right? And if you request this EXR within 60 months of the period of time when they terminated your benefit. So you have another 5 years to utilize this if need be after the point at which they terminate your benefits. Now, here's the thing I want you to know too. I didn't put this in here, but it's kind of a lighter standard, and as they look at your medical condition, what they're really looking at when they evaluate EXR is, have you medically improved since the time we originally took your claim? Now, if you're out there working, you were probably doing good for a time, but if you had to stop working because of your condition, you probably didn't medically improve, did you? You probably worsened. So this makes the case for making EXR pretty easy lift to be eligible for. One other piece that's really important about EXR, while they're making a decision as to whether you're eligible again under EXR, you can receive 6 months of provisional benefits while they're deciding if you're still disabled under their rules. I mean, you certainly don't get that when you apply initially, do you, right? So you can not only get a backdoor to Social Security with a lighter medical review standard that you have to meet but you get paid your original benefit while they're making this decision. Now, that's a pretty good ace to have up our sleeve, isn't it, when you're trying to return to work and you're worried that if you try all this and it still fails, what happens to me? Well, here's what we might have to use. I don't like when we have to use this, but I can tell you, folks, that over the years I've used this a number of times, not a huge amount, maybe a dozen times with folks that ended up in that situation, and every time it went through. So that's pretty exciting, and that's another work incentive that probably folks don't know a lot about that I think you should know as you consider this return to work. So I'm going to move on to wage reporting. So we've given you some high-level information, and I know I'm giving you lots of information today, but there's some things I want you to know about wage reporting. In terms of disability, Social Security counts your wages when they were earned, not the date of your paycheck. Okay? I'm going to say that again. So your wages, if you're on disability, count when you earn them. They don't care about the date of your paycheck. I'm going to show you how to figure this out. And why is that so important? Well, there's specific numbers associated with the trial work period, the SGA limit, so you can be sure. We want to be able to accurately depict what you've earned in a month in order for you to take advantage of these incentives appropriately. Let's look at how this plays out. So I give you an example. Apparently, Joe, in this example, is getting paid every 2 weeks. So in this case, and excuse the calendars, it looks like that's the last time I put this example together. Same idea. Joe's got a two-week pay period here that went from August into September. Okay. And I used real simple math here. $600 is what he got. Not a very healthy paycheck, Joe. He's going to have to step up his game for that 2-week pay period. And in terms of SGA purposes, this is how Social Security looks at his wages. It would need to be broken into a day rate. The only way we can figure out what he earned in a particular month is to develop a day rate. Well, we know in a 2-week pay period he had 10 working days. So what we do is pretty basic. We take his full pay, $600, divide that by the number of days that he worked, 10, and we get his $60 per day rate. Okay? So what do we do next? We look at how many of those work days occurred in August. In this example, 8. So 8 times 6, $480 in August should be associated with that month, and the remaining 120 should be counted in September. Why does that matter? Well, it could matter in terms of the use of work incentives. Again, maybe the trial work period would be used one month but not the other. There's lots of reasons why this is to your advantage to report your wages. It's more so in your favor to do this and to do it well and to make sure Social Security always is aware. In fact, here's some responsibilities I wanted to put in front of you about your return to work and things you should do. You have to report new work activity to your local Social Security office. In that letter that you would send them, I recommend that you include at least the following: the name of your new employer, number of hours a week and wage and so forth, date you started. If you stopped working, by the way, you have to report that too, and then an end date would be applicable, okay? If you know it's a short-term job too, you could also add the end date right at that time that you're reporting the new work, so if it's a temporary thing. And always include your Social Security number. If they can't associate it with you, they have a special file. I'm sure they put all these in, but it won't end up in your record. Next, you need to provide wage data monthly. Provide a copy of your paycheck stub, okay? And by the way, make sure that you write your Social Security number on your paycheck stub because that won't be included. And if your name isn't already on it, make sure it's printed on that. You can fax, hand deliver, or mail these. I will also recommend highly that you ask for a receipt when you send those in. Okay? And you can ask for a receipt for something that you provide Social Security. It gives so it's proof that you submitted those wages in this case. So monthly. Oh, one last thing on this. Often people are told by Social Security if they're on disability, you don't have to report monthly. I'm telling you today, report monthly. I don't care if you're told, send us the information quarterly. If I was you, I would send everything in monthly, and I would get proof of your submission of those paycheck stubs every time you go to the office. So we're going to turn the page here now. We're going to talk about some additional supports available to you. If you liked what you heard today, some of you probably are thinking, boy, I didn't have this headache before this started. I hope that's not the case. I know it's a lot of information. I got a little, more than one message that it was. And so let's talk more about, well, how do you get support in this, okay? You don't have to be on your own. And there's many ways to get assistance in your corner. So there's a few different things we're going to cover in these slides. Additional programs that can support you, one of which is Medicaid buy-in, and then people that can support you. We'll get to that soon. So the Medicaid buy-in program, what is the purpose? Well, the short story is this. The purpose of the Medicaid buy-in program is to provide expanded Medicaid coverage specifically for people that are disabled and working. In fact, in most states, it's very generous increases in the guidelines that can get you eligible for Medicaid, okay? Here's some sample criteria, but I'm not even going to go through that because I got to tell you, every state's going to be different. There's not a great place, honestly, folks, to send you to learn exactly about what your Medicaid buy-in option is in your state, or if it's even available. But I've given you a link here that you can at least start your research from. And certainly, if you have a connection to a Department of Social Services or Health and Human Services in your state, they would be able to also direct you to find out more about that. We talked today about benefits and work incentive advisement, and I was pretty strong on how important I think this is to have this information in your corner. And if you're sitting there and you're thinking, this is confusing, this is information overload, well, that's why I want somebody like this in your corner. I mean, I didn't do provide what we did today to confuse you, but certainly to show you that, I mean, this is complicated, and that was as simplified as we could make it today. So you really need somebody in your corner. These folks can help you understand lots of things about your benefits, and we'll provide you that written report. There's a link there that you can go to that shows you by state how to find a WIPA provider in your state. And that is a free service, by the way, folks. You don't have to pay for that. Now, let's see here. Protection and Advocacy is another service available to beneficiaries called PABS, Protection and Advocacy for Beneficiaries of Social Security. This can come into play when there are legal matters that impact your ability to return to work. I guess that's the simplest way to put it. And there's lots of reasons that they would be able to support somebody. There's a lot of situations when they would get involved. If you're unsure of your situation, I recommend, again, that you find a provider. If you have a legal situation and you're not sure, is that something that they could help with? Well, find your local PABS provider. There's the link for you, and ask them directly because the eligibility varies. Ticket to Work is something that's near and dear to my heart, and this is a program that Social Security has developed to assist people that receive both disability or SSI who want to return to work. The whole intention of the ticket program was to increase the universe of providers that exist across the country to give people support in the return to work. Because before the ticket program, I mean, really the choices were, VR, state VR, vocational rehabilitation, or maybe some local options. But, the ticket program really did change this a fair bit and brings a lot of new providers into the mix. The ticket program manager for SSA is called Maximus, and the site that you can find them at is listed right there. There are employment networks that can help you out under the Ticket to Work program. These are contractors who meet Social Security's requirements to be able to provide these services and have the requisite skills to provide these services to individuals just like yourself that want to get back to work. It's quite a lengthy process to become an employment network. And if you're looking for this as a possibility, there's a link at the bottom to find an employment network near you. But I think I would be remiss if I didn't tell you one option that you have that's right under the roof of National Disability Institute. The American Dream Employment Network is an employment network under contract with Social Security. We've been in business for about a year. It's a very different approach to serving folks, this is, I'm one of the co-directors of AIDEN, as we call it, and I thought I'd just share with you, since we have this option internally, a little more about what this is, what this can do. Our key stakeholders are kind of laid out here. Participants, that would be folks like yourself that want to try this return to work. They want somebody in their corner. They want to understand benefits, how they can use work incentives, and so forth. You're our primary customer. You're the folks that we want to see get back to work and have more financial security in your life because of work. And anybody who receives benefits between the ages of 18 and 64 is eligible to participate in the ticket program if they choose to. It is your choice, okay? members, the way we're developing, the way we've developed AIDN, members represent providers across the country that have the right skill set to offer these services to folks like yourself that want to get back to work. And what's different about AIDN is we're an administrative employment network. So we contract with members to work with participants. So we really support our members to make this whole process of engaging with Social Security easy so they can do what they do best, which is help people, participants as we call folks that receive benefits, get back to work. That's what they do best. They do placement work, you know, helping people get jobs and careers, okay? So members are who we contract with across the country to help folks get back to work. And we also have formal agreements with employers. We call those folks employer partners that have a commitment to diversify their workforce and hire people with disabilities. Now, our agreement doesn't require they hire people, but it opens the door for us to work with employers, specific employers that we have agreements with. That's just a snapshot of AIDN. I was really maybe being a little selfish today showing you that, but I was really happy to be able to share that with you. And if you'd like to know more about AIDN and taking part, whether you're a beneficiary, if you're a beneficiary and you want to know more about AIDN and the supports that we can offer you to get back to work, there's our toll-free line, and just use extension 1, and you'll find me at that number. If you're a service provider and you say, boy, that sounds interesting, we have not taken advantage of the ticket program because of the complexities you just spelled out, but maybe it'd be easier as a member of AIDN. Well, certainly contact us, same number, use extension 2. Now, vocational rehabilitation systems are still, of course, an option for folks, and these exist in each state. And this is another option to support you in the return to work. There's a link that I've provided here at the bottom of this slide for you to find your state VR agency in your state. But certainly they can help also with employment goals, skills and aptitude, providing you know, career counseling. There's a very similar offerings between VR and employment networks. I just love that people have more choices, though. Department of Labor, here's another great resource we wanted to share with you. They're called American Job Centers. I'm still blown away that a lot of people don't know these exist. These are entities that exist across the country, publicly funded, available for anybody to access, and they're established under these acts that we have spelled out here. I won't have time to get into. I'm getting a little message that I have to move along. So, but the AJCs are basically, you know, there to serve folks that want to get back to work. They can connect you with their state's job bank, and so you can get leads. Lots of training goes on there, workshops, and great supportive staff at American Job Centers. If you want to know if you have one and where it is and if it's close by, here's a link for a locator to find an AJC that's near you. Also in the mix that we thought was important for you to understand was independent living centers. There are many CILs, Centers for Independent Living, across the country. Their purpose is really advocacy and to help people to continue to live independently as much as possible. They do many different things. They're set up very differently across the country, from providing direct services to help people get back to work to peer support. So information referral, it really depends, but I would also encourage you to look at those folks as a support in your return to work process. There's a link at the bottom. Again, you know the drill. That's where you can find more information about CILs. Last but not least, and I'll turn this back to my colleague here in just a moment, is, you know, we didn't talk about SSI today. You can see why we didn't. I mean, can you imagine we'd keep you here until late into the night. So, but if you want to find out some more basics about SSI, there's a great YouTube video that we want to direct you to, and here's the link to that. And it gives you just some of the basics of the impact of work on SSI, which I got to tell you, folks, is completely different than what we covered on disability today, very different, okay? So I encourage you to look at these resources. I know it's a lot of information. I think what I'm going to ask is that you just let this digest and think about these things. But, you know, I'm going to turn back to Elizabeth, my colleague Elizabeth Jennings, so she can give you some ideas about maybe next steps that you might want to take. Elizabeth?
Thank you so much, Kevin. Really appreciate all that information. I know it was a lot, but you're going to have our contact information in just a minute, and then we're going to answer a couple of questions. So I wanted to give you a few suggested next steps. It's always great to have some action steps. One is if you're thinking about going back to work and you want to kind of figure out what's out there, what the process would be for you, to consider signing up with one of the following programs: your local vocational rehabilitation office, and we gave you, they don't have a very direct finder, but this is a great link to get started. The local one-stop center. Now, in some areas, they're called a workforce center, and in some areas, they're called an American Job Center. So be a little bit patient with them, but this service locator will get you there. And then also you can think about the Ticket to Work program, and you can look to us through our AIDEN project, or you can go to choosework.net and watch some videos and get a better idea from the Social Security Administration of how that program works. Step 2 is to meet with a benefits planner. So you want to make sure, as Kevin suggested, that you're not relying on your memory of what you learned today, or you're not feeling overwhelmed by this, but that you're sitting down and talking to someone specifically about your situation. We also encourage you to take step 3, which is to go back and look at some of the other archives that we've done. You know, sometimes thinking through an employment goal, it's just to remanage your finances, or maybe it's to have more money in your pocket, and some of these other webinars may be very helpful in that endeavor. And then I encourage you to set a goal to complete items 1, 2, and 3 over the next 3 months. I know we're coming upon the new year, and lots of people do New Year's resolutions. I'll tell you, my New Year's resolutions paperwork is still sitting on my dresser from last year. I did not do a good job with that resolution. So if you're like me and resolutions don't really work for you, maybe set a goal, post it up in your house, put it on the fridge, share it with a friend or a loved one, someone who can help you to stay accountable, kind of give you those nudges, and then reach out to us or one of the other contacts that we've offered you. So before we answer questions and run out of time, I want to say thank you again to our sponsor, Acorda Therapeutics, whose generous funding has made these webinars possible. And here's our contact information, mine and Kevin's. You're welcome to reach out to either of us. We're both kind of benefit junkies and love talking to you about how to understand your benefits and get back to work. So Kevin, let's do just a couple of questions before we're completely out of time. One question that was asked is, what do you do if you've gone to the local Social Security office to report your wages in person, but your checks are still coming?
Well, Elizabeth, number one, I hope that person is connected to an advisor. Again, I'm going to keep telling you that. But if you're continuing to get your check and you know it should stop, I mean, so I'm going to assume that this person understands that their check probably should have stopped, maybe because they got advisement. Here's my best advice without knowing a lot of detail. Hang on to those checks in case you're concerned that you should not have received them. And it may be possible that you'd have to pay back, you know, some of those checks, okay? But knowing that you shouldn't get them, and also let Social Security know you're continuing to receive the, you know, it's funny, I tell you folks, sometimes it feels like stopping benefits is as hard as getting benefits. I sometimes feel like it's a freight train out of control trying to get Social Security to stop benefits. So just hang on to them, inform them that you've been receiving them, and that you need to know when the last month was that you should have received your benefits, and that will clue them in, oh, we better review this case, we better update the record, and then they will stop benefits. And they may ask for some of that back, so rather than spend it, hang on to it if you know that that was last month you should have gotten it, in case you have to return some of that money.
Thanks, Kevin. A second question is, when is the right time for me to call the WIPA?
The right time for you to call WIPA is when you're thinking about returning to work. And I'm not saying you're working today, but you have a plan, okay? Now, I'm going to tell you that they're going to give priority to people who are working, but I want you to connect with them and just say, you know, I want to work, I have a goal of work, I plan to work, and, you know, if you're in that stage where you're seeking employment, you call WIPA. Don't wait for that, because then they can do some advanced planning with you and develop one of those reports based on some projections, maybe not reality at that point, but projections. And that will give you a lot of great information of what to expect when you do go to work.
Another question is, what do you suggest for a 19-year-old who is blind, who's on SSDI, and is going to head to college this fall? Is there any work incentive that they might want to consider?
Well, congratulations, whoever this person is that's 19 and going to college, because that's the first step in the right direction to a better financial future. So that's great. I would recommend, again, that you get a counselor in your corner, benefits counselor, and I'm going to guess if you're not open, I'm going to guess you're open with your state's VR program, okay? And you can request that assistance from your VR counselor. Often VR systems have a contract in play to be able to pay for that service locally where they have somebody on staff that's got the expertise. So get that person. I'm going to recommend it just like I did the other person. Get the person in your corner up front right away so they can start looking at your specific situation and start doing some planning with you. You don't have to wait until you're ready to go to work tomorrow, okay? In fact, you shouldn't. You should get this in your corner, this kind of support, earlier rather than later.
Okay, and I'm going to keep the last question for myself, Kevin. It's, can you confirm that tax returns do not apply to resources and have up to 12 months to spend? So this is a great heading into our next webinar, which is going to be held on February 3rd. If you haven't signed up, I hope you will. It'll be at the same time, 3 p.m. Eastern on February 3rd. We'll go over favorable tax provisions, how to get your taxes done for free, and we will affirm that for any federally funded public benefit, your tax return does not count as income, and the money will not count as a resource for up to 12 months. But do remember that SSDI does not have an asset limit, so it's some of your other public benefits that resource exclusion is beneficial to. I want to thank you all again for joining us today. A tremendous thank you to Kevin Nickerson for sharing your incredible expertise and experience with us today. If you haven't had a chance to connect with us before, please reach out to us. We'd love to hear from you and some of the other trainings you'd like us to provide. We'll connect you to the archives and to any other information that you need. And we hope we'll see you here again on February 3rd at 3 p.m. for a webinar on favorable tax provisions. Thanks so much again. Have a great day.